My name is Pastor Lipava, and today we are going to discuss more about anal fistula. So I have joined by a guest or health specialist who will give us more insight about anal fistula. So I welcome you and I beseech you to introduce yourself.
Okay, my name is Faith Fry.
Okay, so let's talk about anal fistula. What is it?
An anal fistula is an abnormal swelling that develops from inside your anus.
Yeah.
The skin outside, it usually develops in the upper part of your anus, where your glands are. When these glands become infected, drainage from the infection can create a fistula. This infection is called a perianal abscess. Sometimes an anal fistula is also called a perianal fistula. Perianal means in the region of your anus.
Okay, so how common is this condition?
A fistula is relatively common on rectal condition. It's twice as common in men and people assigned male at birth.
Yeah.
About half of people who get an infected anal gland will develop a fistula. An infected gland that forms an abscess, a pocket of pus that needs to drain, causes 75% of anal fistula. Yeah.
Okay, so what are the anal fistula symptoms?
Okay, there's many symptoms of anal fistula. Firstly, anal pain, often intense and throbbing. You may feel more when you pop, cough, or sit. Your butt may be sensitive to touch, and swelling and redness inside or around your anus.
Yeah.
These are signs of active infection under the skin, and fluid drainage from somewhere around your anus. It may include pus, pop, or blood. It may have a smell. And less common symptoms include fever, pain when you pee, difficult holding your pop in. You may or may not be able to see the fistula with a mirror. It is all.
Okay, so what does anal fistula look like?
Okay, an anal fistula looks like a hole in the skin near your anus. The hole is actually outside outmost portion of the channel, which connects to the abscess inside. It might ooze drainage like pus, blood, or pop, especially when you touch the skin around it. Some other fistulas may close at the opening, while the rest of the channel remains. This causes pain and swelling until the fistula reopens to let out the drainage.
Okay, so what causes an anal fistula?
Fistula can occur throughout your body, either between different organs or from an organ to an opening in your skin. They usually occur when your tissues are inflamed for a long time due to an injury or disease. Chronic inflammation and infection can eventually erode into the nearby tissues, especially when pus needs to drain. This can create a channel between the wound and nearby tissues.
Okay. So what are the risk factors for getting an anal fistula?
The most common causes of an anal fistula is a perianal abscess, which usually forms over an infected anal gland. An abscess is a pocket of pus that develops at the site of an infection. The pus needs to drain away and may create its own drainage channel to the outside. Sometimes a healthcare provider creates a drainage channel to treat the abscess, but often the wound doesn't heal completely, leaving a fistula. And common causes of anal fistula include inflammatory bowel diseases such as Crohn's disease, anal eyes, tuberculosis infecting your anus, a traumatic injury or previous surgery in your anus, radiation thereby for cancer in your pelvic region, actionomycosis, a rare bacterial infection that causes abscess, sometimes in your perianal region, hydrotic suppurative, a chronic inflammatory skin disease that produces abscess in your sweat glands, occasionally in your perianal region.
Okay, so what are the possible complications of an anal fistula?
Okay, you're more likely to get an anal fistula if you were assigned male at birth, have had a perianal abscess in the past, have an inflammatory bowel diseases such as Crohn's, have a history of surgery or radiation thereby in your perianal region, are immunocompromised or prone to more frequent infections, have a chronic STIs. That's all.
Okay, so how is anal fistula diagnosed?
Okay, a fistula that goes untreated generally won't heal on its own. This can lead to long-term complications such as persistent infection. A fistula that stems from an abscess or infection may keep the infection active. The infection may seem to go away at the original site, but then return, forming a new abscess and causing renewed pain. Sometimes the fistula may seem to be healing and may close at the opening, but reoccurring infection and drainage later open it again in repeating cycle.
Okay. So will I have any other medical test?
Healthcare providers can find most anal fistulas during a physical exam, but sometimes the opening to the outside is closed. Your provider will also want to find the inside opening to the fistula within your anus. This part might require anesthesia if has to match for your provider to touch or open your anus to examine.
So, will I have any other medical test?
Your healthcare provider might need to take imaging tests to see the path of your fistula. This might mean MRI. In MRI is a non-invasive imaging test that provides high detail. This can help providers map the path of the tunnel and Also see how it interacts with your muscles and other organs. Yeah.
That's all.
No. Endoscopic ultrasound as an alternative to MRI that produces similar images. An endoscopic ultrasound goes inside your anus with a tiny lightened camera and a tiny ultrasound probe. Fistulagram. A fistulagram is an X-ray of your fistula that your healthcare provider takes after injecting dye into it. The dye will highlight the path of the fistula. Your provider needs to know the pathway of your fistula in order to determine how to treat it. They will classify your fistula by its pathway. Yeah, that's all.
Okay, so what are the different types of anal fistula?
Okay, healthcare providers classify anal fistula by where they are located in relation to your anal scata muscles. These are the muscles that control your bowel move. It's important to protect them. Your provider might refer to your anal fistula by a specific name based on its location, such as interfectoric anal fistula. Passes through your internal anal sphincter muscle and then burrows out through the space between your internal and external sphincter muscles. Transeptal fistula travels through both layers of your anal sphincter muscles. Suprasphincteric fistula passes through your internal sphincter and then goes around your external sphincter. Extrasphincteric fistula goes around both sphincter muscles. This less common type usually originates from your rectum rather than your anus, so it doesn't come from an anal gland.
Okay, so what is the treatment for an anal fistula?
Most anal fistula will require surgery to fix. Spontaneous healing is usually requiring infections and abscess that reopen the fistula. However, if your fistula is caused by inflammatory bowel disease and isn't infected, it will occasionally heal with medical treatment. Your provider might try treatment with an immunomodulator, like infliximab, before resorting to surgery for these fistulas. Surgery. An anal fistula surgery can be simple or complex, depending on how simple or complex fistula is. The most common anal fistula are simple interfectoric fistulas, which only involve a small amount of muscle. These are safe to treat in a single operation. More complex fistulas may need surgery in stages. The first stage is simple fistula. If your anal fistula involves only a minor amount of muscle and doesn't have any branches, is considered a simple fistula. The surgical treatment for a simple fistula is called a fistulotomy. This one and done procedure is the easiest and most effective way to treat an anal fistula. Second one, fistulotomy. Your Collateral surgery will out through the roof of the fistula, allowing it to fill in from the bottom up. They might also remove infected tissue. Cutting through the roof may be cutting through a small amount of muscle, but a little is okay. Cutting too much muscle risks damaging your bone control. Third one is complex fistula. Your fistula is considered complex if it involves a significant amount of muscle, if it has branches, or if you have pre-existing conditions that raise your risk of complications from surgery. Complex fistula may require multiple surgeries to fix. Your correctional surgery may use one or more of these techniques. Seton drain. A seton is a type of surgical thread that isn't absorbed over time, but must be removed a surgeon loops the seton through your fistula to help keep it open long. Be removed enough to drain all the danger discharge out. A seton can also slowly cut through the fistula tract, allowing the tissue to heal as it cuts through the muscle. Lastly, it helps with local scattering of the tissue so that the wound doesn't pull apart later. Your surgery may remove the drain and close the fistula with a fistulotomy or another procedure. If your fistula is caused by a chronic condition like a inflammatory bone disease, your surgeon might leave the seton drain in place indefinitely. And the rectal advancement flap. This procedure avoids cutting into the loop of the fistula, so your effector muscle stay intact. Instead, your surgeon cuts out the infected tissue along the inside opening of your anal fistula. Then they cover this opening by pulling down flap of healthy tissue from the inside of your rectum above it. The fistula should continue to drain out of the outside opening and then begin healing from the inside. This procedure is considered about 70% effective, but in some cases the infection and the fistula still come back. Therefore, there are also still some risk of injuring the fracture muscle when cutting the flap.
That's all? So, what are the risks of anal fistula surgery?
The main risks are reoccurring infection. If the infection inside completely gone from your fistula, it may continue inside your healing fistula. Antibiotics can usually treat a reoccurring infection. Reoccurring fistula An anal fistula may come back after surgery if it doesn't heal completely. This might be because of underlying chronic conditions or because of all the technique used.
Yeah.
Fecal inconsistency. Some people experience slightly compromised fecal contents. Yeah, that's all.
Okay, so what is the recovery like from anal fistula surgery?
Okay, an anal fistula procedures are generally outpatient procedures, so you can go home the same day, although some people will need to return for more surgery later. You have prescriptions paid medication to take home with you, along with some instructions for self-care. This may include water and fiber supplements. Pain medications can cause constipation, so your provider might prescribe fiber supplements. To prevent this, is important to take this with lots of water.
Okay.
Yeah.
So what should I expect if I have an anal fistula?
Your outlook you depend on how simple or complex your anal fistula is. This determines how extensive the treatment and recovery process will be. In general, you can expect to spend 3 to 6 weeks recovering from one or several surgeries. Some fistula retain surgery, especially if they had many branches or they were caused by a chronic condition. Some people with IBD get multiple anal fistulas.
Okay, so when should I see my healthcare provider about an anal fistula?
Okay, always see a healthcare provider about anal pain. Unusual conditions that cause significant pain may be serious. Don't assume it's something that will go away by itself. Hemorrhoids may be more common and familiar, but they aren't usually very painful. If a general practitioner tells you it's hemorrhoid but the pain continues, see a specialist like a genetologist or a cardiac surgeon.
Okay, so what is perianal vaginal fistula?
Okay. A perianal vaginal fistula is usually called a rectovaginal fistula because it usually connects from your rectum to your vagina. Your rectum is the part of your large intestine that comes just before your anus. The border between your rectum and vagina is much narrower than between your vagina and anus. A vaginal fistula can develop from any part of your intestines, but it's usually from your rectum or colon.
Okay. So what is the difference between the anal fistula and the anal fistula?
An anal fistula is a split or tear in the lining of your anal canal. It can cause similar symptoms to an anal fistula, but a fissure is a superficial wound. It doesn't channel through your anal wall to your skin the way a fistula does. However, it's possible that an anal fissure could develop into an anal fistula. If an anal fissure become infected, it could form an abscess, which could create an anal fistula when it drains.
Okay.
Yeah.
So what is your advice or nutshell to people who are affected or not?
Okay. Severe anal pain can be both physically and psychologically
Yeah.
debilitating. Not only does it hurt you every time you sit or visit the toilet, but it may feel like a difficult thing to discuss with a healthcare provider.
Yeah.
Don't let this stop you. Anorectal diseases and conditions deserve the same attention as any other. An anal fistula needs treatment, and the sooner you get it, the simpler that treatment is like to be.
Okay, so this is the end of our discussion for today, and thank you very much for giving stunning information like this one, and I'm appreciating about that. So this is the end of our discussion. You were with me, Pastor Pava, as a host and
Faith Fry.
as our expert for today.